healthcare health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, Living a Longer and Healthier Life. We're going to talk pulmonology for the first half hour and then medical education for the second half hour. So definitely want to get right into it. We have pulmonologist, you'll probably remember him from last month, Dr. Joseph Giaimo. He's a board-certified osteopathic internist and pulmonologist, and I believe he's triple board certified, so he's also board certified in sleep medicine, which is just unbelievable to have a doctor of that magnitude on the show. So I want to welcome him back to the show. Dr. Giaimo, how you doing today?
Very good. Thank you so much for having us back again. It was a pleasure to speak with you guys.
Thank you, and I have to thank you for being so prompt and on schedule. Every time I talk with you, whether it's over the phone or email, you always get back to me in such a timely manner. And I got to say, you know, we do have patients listening to this show as well as other doctors in the community, and I can be a testimonial right now for Dr. Giaimo. He always gets back to you. He's very prompt, and he's always on time. He even called in early to the show because he's up in Palm Beach Gardens, as you know, where our studio is in Boca Raton. So I just had to say that because I think that's important to have someone who's always prompt and on time in life. So without further ado, I'm going to get right into it, Dr. Giaimo. But thanks again. I do appreciate it.
Oh, you're welcome. You're welcome.
So last time you were on the program, I kind of had you explain everything you possibly know about COPD. No, that's not true. Obviously, you know a lot more. But we really got into COPD. And tonight I want to take a little different step and talk a little bit more about some other respiratory ailments. And one of them is asthma, which I think is a key term that we all know, but I actually told the story last time when you were on the program. I had a friend who had asthma growing up, and I just knew that she always had that inhaler with her, but I didn't know much about it. So tell us a little bit about asthma, and then what are the symptoms of asthma, and when do people tend to come to see pulmonologists for that ailment?
Well, certainly, asthma is reversible airways disease. So by the definition of it, it's something that you can function very highly with it. I mean, you even see, we're watching the Olympics now, and you see Olympic athletes and world-class athletes who can have asthma, but it also can be quite debilitating. So when you're going through a period where you're having an exacerbation or a worsening of your symptoms, it can be very limiting for people. So it's the type of process that generally there are types of triggers that cause an inflammatory reaction in the lungs. That inflammation causes spasm, and the spasm can also lead to inflammation and secretions and those things. So it's a complex issue, but it's very, very common, and we're seeing it more and more in our society today as we have more environmental and toxic things that we get exposed to in our environment.
Now, explain to us how an inhaler works, and why is that helpful during an asthma attack?
Well, asthma, the main way that the inhalers work is they work directly on the site of inflammation and where the disease process is. So there are different types of receptors in the lungs, and there are ones that cause bronchodilation, that cause the airway to constrict and the air to contract. And so the primary medications that we use for asthma are bronchodilators, or things that help work on these receptors to open up the lung and stop some of the wheezing. The secondary thing we look at is inflammation, because there's a large component to inflammation in the lungs. So if people have had continued bouts of asthma, eventually the spasm, the wheezing of the lungs, is also overtaken by the inflammation, and the airways themselves become very narrow. So the main goal of treatment is to try to treat the inflammation and also to treat the bronchospasm that people have. So the inhaled agents work very well because you can inhale them, they go directly to the site. Some of them are absorbed into the body, but the majority of them go right to the site where they're needed.
Okay, we're here with Dr. Joseph Giaimo. He's a board-certified osteopathic internist, pulmonologist, and sleep medicine specialist with an office in Palm Beach Gardens. I'm going to give the info out in a couple minutes here. So, Dr. Giaimo, thank you for explaining a little bit about the key parts of asthma and treatment. And I had a question. I kind of thought of it this afternoon. I never really know if I ever looked up the answer. Can asthma be cured, or is it something that has to, like COPD, kind of be stopped and managed throughout life?
Well, most of the time when we think about asthma, it can go in various stages. It can become very severe and debilitating in some individuals, but the majority of people can be treated and they can function very highly. As far as getting rid of asthma we see two distributions of asthma. Very young in people's lives, we see a lot of children with asthma, and then as they get older, they tend to outgrow it to some degree and it becomes less severe. And then also we see a little later in life, we see there's another higher incidence of asthma that arises. So it's never truly cured. I think it's controlled and managed, but it should, in the majority of patients that we see, it should be able to be managed very well, and they should have full productive lives. It shouldn't limit their life or their exposure, and they should be able to do the things that they want to.
Is it congenital, or is it something that you're born with, or develops as the lungs develop through infancy and on?
Well, sort of a combination of both. There's a higher incidence of asthma in children whose parents are smokers and different, what they call lower socioeconomic classes, because what happens then is that there's nutritional things and those things that don't happen, and people don't develop their lungs as well. So you do have a genetic predisposition to it. You have families that have more significant asthma, but the majority of it is related to environmental exposures that you have. Having a influenza or infections as a child will set you up for more reactive airways disease and having problems. Children who are premature, children who have different types of nutritional deficits are more common to have asthma. And then later in life, like people who were exposed to something like 9/11, they have very significant asthma, those individuals, and it becomes very difficult to treat. So a large fume or gas exposure, people who work in various industries, people who are hairdressers or hairstylists who use a lot of those products, they get the inflammation, and that kind of stuff can cause asthmatic symptoms. People who are exposed in different agricultural industries can get it. So it's a combination of two things, where you're in the environment and also you have a predilection to it.
And we're here with Dr. Joseph Giaimo. Great website if you want to go back and look at any of this information is giaimolungdoc.com. Dr. Giaimo's last name is spelled Giaimo, and then you're just going to put in lung and doc.com. Actually, if you click on there, there's a For Patients button, and if you go down, of course, it has the patient forms, which is extremely helpful when you're going to your doctor or finding a new doctor, so you can get them right there. And then as you go down, there's a search button for asthma. And one of the facts I found on there is 25 million Americans are living with asthma. Dr. Giaimo, I didn't realize it was that many, and I do want to also mention your website is a great source of info that I actually used to research a little for the show. So 25 million Americans, that many.
Oh, it's huge, yeah. Oh, thank you. Yeah, we try to spend some time on the website to try to give information. I find it's always better to have your patients and people in the community know more about diseases. So that's why shows like yours are very helpful, because people get a chance to, ask questions and interact and also have more knowledge about things. But asthma is very, very prevalent. It's, as you see last time, we had spoken a little bit about sleep medicine before, and you talk to people in a community, and all of a sudden you realize, they say, they had asthma as a child, and maybe it influenced them a little bit in some of the decisions they made. But now they're highly functioning. They're able to go out and do the activities they want. They can swim and play tennis or run and do all those things. So it's a very common entity. It's a very common thing to find in our communities, but it is something that certainly can be treated, and it can be treated very well. by your practitioners, by your physicians, and those things when they get a chance to evaluate you. It just needs to be followed up on, and you have to have a little education about it and know the symptoms and things that can make it worse, and some of the things that you can do to try to intercede so you don't develop an exacerbation.
And I also see on the website that's 9 million children with asthma in the U.S., 16 million adults, and up to 44,000 people have an asthma attack every day. And like Dr. Giaimo said, the symptoms are on the website, even emergency symptoms that need prompt medical help. So if you have a chance, you can always, like Dr. Giaimo said, you can write into this show on Facebook Live or on All County Healthcare Incorporated INC Facebook Live page, and I can see the questions as we go. I see the viewers that we have right now. And then also 1-888-565-1470. I'll have Dr. Giaimo here until at least 6:30. Another topic I wanted to talk about a little bit that we didn't get into last week was emphysema. And I had a question. Does emphysema go along with COPD, that chronic obstructive pulmonary disease we talked about last month?
Yes, it does. I mean, you look at it, it's really a spectrum of disease. COPD, at one end of the spectrum, you have mostly the spasm, the chronic asthmatic patients. And at the other end of the spectrum, you have the patients who have primarily the destructive changes in the lung, and that's what emphysema is. Emphysema is when those small air sacs, the alveoli, become destroyed and they coalesce into larger, less functioning air sacs, so they don't exchange the gas as well. And so emphysema certainly is the destructive disease that we see, and there's not a lot to do to cure that or to fix that. Most of what we do is to try to function on the areas of the lung that are in good shape, and that we can try to maximize those.
I see. And we are going to take a quick commercial break. And on the other side, a very timely issue to this area, keyword dive medicine. I've never seen a doctor who can talk to you about dive medicine, that's scuba diving, on the You and Your Doctor show right when we come back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to the You and Your Doctor show, living a longer and healthier life. We're here with Dr. Joseph Giaimo, board-certified osteopathic, internist pulmonologist, and sleep medicine specialist. We talked with Dr. Giaimo a little bit about asthma already and emphysema. If you ever want to view the shows at a later date, you can always go to allcountyhealthcare.com. There's a radio tab right at the top. Just click it and you can see all the shows. You'll see my smiling face on there, as well as the doctors. Another place, if you ever have questions, like I said, Facebook Live, just put in All County Healthcare INC in the search bar. You'll find their page. Go ahead and like it and share this video, or go back and access it on your own. So we have like a little library of all the shows going on. And we're bringing you the latest and the greatest in healthcare. And this is so cool. When I saw this on the website, of Dr. Joseph Giaimo. I thought this is right up my alley. I grew up spearfishing. Actually, I've only been scuba diving once. I'm a little hesitant to do it because, as everyone knows, obviously overweight, but working on it. But one of the reasons I do want to lose weight is to go scuba diving on the Great Barrier Reef with my wife, but also go scuba diving right here in Palm Beach County. And I'm sure Dr. Giaimo's been 80 feet down because he is a specialist in dive medicine. Dr. Giaimo, this is so awesome. Tell me about dive medicine.
Well, there's a lot of physicians certainly in the county who have a lot more experience than I. I had done most of my work with dive medicine when I was in the Navy. I mean, it's an off branch, and you can see a number of different disciplines work with dive medicine. There's a number of physicians who dive here in the community who actually will run the different dive centers, at some of the facilities here we have, because people, when they do dive, unfortunately, some do develop respiratory issues, and they have problems, and they come up with the bends or have other issues when they're down there, and then they have to go to the tanks. So there's a few tanks here in town where they can actually come and decompress and do that. We had talked briefly before about asthma. When we were talking about asthma, that's really one of the contraindications for diving, because when people go and dive, even snorkeling and that kind of stuff, sometimes you can develop some respiratory problems. So you really want to try to make sure you're in good health before you go and dive. As you were mentioning before, it's always something that we can enjoy, and we live in a beautiful area to be able to do that, but you just want to be cautious when you do dive to make sure that when you're diving, certainly the safety protocols and those kind of things that you do with diving with a partner and diving with people who have some experience, and making sure that you keep an eye on all your ascending and descending tables to make sure that you don't have any issues.
Now, not a bad idea also to go see your doctor before you start getting involved into a dive program, right?
Certainly, it's a good idea to get a good physical. I mean, we have people here who will come and they'll go. Unfortunately, there's all too often during we see the lobster season and mini lobster season, people are going out and they're very, very excited to go out and to do that, but then they tend to not take care of themselves when they're doing it. Especially if you're drinking a lot of alcohol and you're diving, it's not really a great combination. And particularly when people are very fatigued, you just want to be very cautious about things. You want to try to get some good rest and try to make sure you stay hydrated and you try to go down with your head clear when you're going to be diving, because you just need to make sure you just don't get into any problems. But there's some beautiful places around here to dive, and certainly you go from here down in the Keys, off of Palm Beach, and off of Singer Island. There's some neat places to do, and there's some wonderful schools that offer a lot of good support. So it's a great place for people when they want to get introduced to the sport, for them to be able to do it.
And I'll attest to that. I'm from Jupiter, so I'm originally from Jupiter native. So definitely I can attest to that. And I like I said, I grew up snorkeling, and it was amazing. I've had some amazing experiences. Only went diving once when I was in much better health. But like I said, I'm going to work on getting back into shape and go see a Dr. Giaimo or a doctor like him before I start a dive program. I said before the break I'd give out Dr. Giaimo's info. So Dr. Joseph A. Giaimo, he's a DO, so that's a doctor of osteopathic medicine. We talked a little bit about the DO versus MD on the last program. He's triple board certified. Wow, you don't see that every day. Pulmonary, sleep, and internal medicine. That is fantastic. Been in Palm Beach County for more than 25 years. His address is 2511 Burns Road, Palm Beach Gardens, right near Palm Beach Gardens Medical Center, and his number is 561-775-3883, and we'll put that up on the screen as well, and I'll try to say it before Dr. Giaimo leaves. One of the things I'm kind of put you on the spot for, I know we didn't talk much about it before the show, is want to get your take on e-cigarettes, because I got to tell you, everywhere I go, I'm walking through vape clouds in the mall. I'm driving by all these vape shops. It seems like there's one on every corner. As a pulmonologist, we got to ask you, what's your feeling on the e-cigarettes? Can it be safer, or what's your feeling?
Well, the initial thought was that this might be an ideal opportunity for people when they're trying to get off of traditional cigarettes, because it is a cleaner burn when they're burning and vaping. It's not all the particles of combustion that you would see in a normal cigarette. I mean, when people smoke a normal cigarette, a lot of the carcinogens are the different products that go, the fillers and those things, that'll be a problem. So vaping was thought to be something that might be a good transition for people, because they can develop nicotine, and there's a number of certainly flavors and that kind of thing that people can go along with it. So it was hoped that might be an opportunity. Unfortunately, there still is a lot of problems, because you're inhaling a gas that is a heated gas into your lungs. So there are still problems, and you can still develop worsening respiratory function. So if somebody, like we said before, somebody is an asthmatic or somebody has underlying lung disease, it still is not a good idea to inhale any substance. So whether that's going through vaping or doing, being around a lot of smoke and any kind of pollutants, they're not really good for you. So unfortunately, there hasn't been a lot of good information saying that vaping is as safe as we hope it to be. It's probably better than cigarette smoking, but it's not without risk. And particularly people who have underlying lung disease, it'd be better, if possible, for them to try to avoid any inhalants at all. So it's not. We still haven't found the magic pellet for this.
Yeah, definitely. Like you said, anything you're going to heat up and then put into your lungs is probably not going to be beneficial. But I just had to ask you, because I mean, do you see it? All these shops on, like, you're or you live in the Palm Beach County area? I mean, it seems like there's. My
office is right as you said on Palm Beach at PGA and Burns, and so as you drive down North Lake, you see a lot of vaping shops. You see a lot of people out there. I mean, you pull up to a traffic light and you'll just see a billow of smoke coming out of somebody's car, and you'll see people vaping. You're out in different communities and you see people doing it all the time. It's I guess for some people it's a more convenient way to be able to smoke, but it still has significant risks with it. And sometimes when people get they can actually put the vaping liquid right on the coils, and they get a very intense burn that way. And those kind of things will cause even more problems for individuals, because now you're taking a very superheated gas and inhaling it, and that's not ideal at all.
We're here with Dr. Joseph Giaimo. He's a pulmonologist in Palm Beach Gardens. Let me ask you this, too, also. If someone was to quit, it's always good to quit smoking, but if someone quits smoking, say, tomorrow, how quick can their lung function return, and how quick can they get to a healthier set of lungs and respiratory system?
Well, certainly, any time somebody quits at whatever stage of lung disease they have is a good idea, because it slows the progression of your lung dysfunction. Normally, as our bodies age, we lose a small percentage of our lung function every year, from probably about the age of 25 on. But somebody who is a smoker, the amount that they lose each year is 10 times as worse. So they use significant more lung function. So it's not so much that you're going to regenerate lungs. That never happens. You're not going to get back lung function, but you're going to not lose at a very rapid progressive rate. And the other aspect with it too is that you look at it that when you stop smoking, almost immediately within 2 to 6 weeks, you start to get some of the added benefits that people, just as far as the chronic cough of the smokers and the other issues that people develop, the higher risk of cancers, not only lung cancer, but multiple different types of cancers go down. The risk of coronary disease goes down, because when you smoke a cigarette, you can develop spasm. You can develop spasm within the coronary arteries and those things, and that can lead to or worsen coronary syndromes like heart attacks and stuff like that. So there's a lot of things that can go on that it really seems to help and work better on for.
Thank you for your insight on that, because I kind of put you on the spot. I didn't send you those questions beforehand, but I knew, knowing you, I knew you'd be a great source to give us a little insight into e-cigarettes and smoking. And so, like I said before, if you want to go back and listen to that, allcountyhealthcare.com, click on the radio tab, or right here on Facebook Live on the All County Healthcare INC Facebook page. One of the questions I had for you today is if you could share a little bit with us any new trends in pulmonology. I had sent you a few that I just Googled a couple terms, but one of them was on a robot improving medication adherence. It looked like it helped people with COPD, and I got to tell the listeners, if I have a little time later on, I'll share a little bit more about it. I was actually in a robotic surgery today with Dr. Joseph Ricotta at Delray Medical Center. It was the first of its kind in the world. It was a vascular robot surgery for the it actually was able to get the plaque out of a patient's legs that was 100% blockage, and prevented a limb salvage. It was a limb salvage, so it prevented a amputation. That's the word it was on the tip of my tongue. So the reason I wanted to mention that is because the use of robots is now getting into medicine. We talk a lot about the Da Vinci robot on this program with general surgeons as well. And before I forget, the surgery Dr. Ricotta did today was with the Corindus CorePath GRX system. It was the first robotic-assisted peripheral vascular intervention in the world. It was a couple-hour surgery. I actually was able to attend and be in the room with Dr. Ricotta and his staff. So I wanted to ask you, Dr. Giaimo, if you've seen any robotics enter into the world of pulmonology.
Oh, yes. I mean, certainly. I mean, that's wonderful that you had a chance to participate in that procedure today and to look at it and see what's going on. Robotics are wonderful. They're using them in all different types. I mean, thoracic surgery, they use robotic surgery and those things. I mean, you look for what they do with prostatic surgery for prostate cancer. So, I mean, I think robotic surgery allows the surgeon to be able to do more minute dissections and be more minimally invasive. And certainly, as far as lung disease is concerned, that is what we look at, because when we have patients who have very severe emphysema, as we talked about before, and their lung dysfunction, that area of the lung is destroyed, then if they have to go through a procedure, particularly a thoracic surgery, like if they have a nodule or a cancer in their lungs, then doing robotic surgery is really the way you would prefer to have those things done, because they can really save as much of the normal lung tissue as possible. And the recovery time is a lot less because you're operating through much smaller portals and not doing large surgeries that disrupt a lot of the chest wall. So certainly robotic surgery is definitely something that is very good, and there's we're fortunate there are surgeons in our community that are very good at that and can be much more eloquent and discuss the techniques and those things than I. But I think that if I'm sending a patient for surgery for their lungs, I want to find somebody who's going to do the most minimally invasive procedure, and the robotics and the technology that they have with that is very helpful.
I gotta say kudos to you and all the physicians in this area. I feel like we have the best physicians in the world in South Florida, and there's really something great going on. Doesn't matter what hospital group you're with or not. These physicians are providing the best care available in that they can, and they're bringing us state-of-the-art care, and that's fantastic. Dr. Giaimo, I got one more question for you. How happy were you that the Philadelphia Eagles won the Super Bowl?
Oh man, that was something real special. I've been going to the game since I was 6 years old with my dad, so we still keep our season tickets. And I have two young boys who unfortunately I'm getting them to bite the bug with the Eagles, because the Philadelphia fans, we've been long suffering. So that was something special to get a chance to watch them win the game.
Hey, you guys deserve it. I've been watching the Philadelphia Eagles, and correct me if I'm wrong, since Dick Vermeil.
Oh yeah,
1980-ish.
1980s, yeah. That was he had a real nice team back then, but they lost to Oakland in the Super Bowl back then.
Okay, yeah, I was 3 years old, but I do remember it, and I remember Dick Vermeil later on. Of course, he had a great run, I believe, with the St. Louis Rams. So, wow, that was awesome. I was pulling for you in the Super Bowl, as you know, I told you beforehand. But kudos to the city of Philadelphia, and what a great run. They were the underdogs throughout the playoffs, and they just came together and played great team football. And it doesn't matter if you're the second-string quarterback or not. I mean, when you're playing team football, You got the city on your side, the teammates on your side. It was awesome.
That's great. And it's sort of like what you were bringing back about the community we have down here. You know, we have people like yourself who are going out and getting the education out, and we have, you know, a lot of good facilities and practitioners out there who provide good health care. So it's all part of a team event. I mean, medicine these days is really very team-oriented and very system-compatible. So, you know, it's everybody working together and bringing their knowledge to it and asking the good questions. So, again, I wanted to thank you for having me on tonight. It's nice to get a chance to talk to people and talk to people about things you have passion with, and thank you again for this opportunity.
Well, thank you. You're always welcome back on the program, and I'm going to give out Dr. Giaimo's info again. Dr. Joseph A. Giaimo. He's a DO, Doctor of Osteopathic Medicine, board-certified internist, so that's internal medicine, pulmonology, and sleep medicine. Great website. Check it out, giaimolungdoc.com. Again, spelling of his name is Giaimo, lungdoc.com. 2511 Burns Road, Palm Beach Gardens, 561-775-3883. Thanks again, Dr. Giaimo.
All right, thank you. Have a good evening.
You too. And on the other side, we're going to talk to Dr. Manuel Gonzalez-Brito from Palmetto General Hospital. He's going to tell us about medical education and why it's important in the hospital setting on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Manuel Gonzalez-Brito, Palmetto General Hospital's Vice President of Medical Education. You've heard me talk a lot about Palmetto General Hospital on the program. Fantastic hospital. I've been there many times. It's in Hialeah, but it is a center of excellence in South Florida. Dr. Manuel Gonzalez-Brito, welcome to the program. How are you doing tonight?
I'm doing fantastic, David. Thank you for having me.
And thanks for joining us on this adventure of health that we bring the listeners across South Florida and the community the latest in health. And I've wanted to have you on. I've heard your name a lot in South Florida, so you were on my list for a while now. And I know you're now Vice President of Medical Education at Palmetto General Hospital. Congratulations on that appointment. That's great information. Great news.
Well, I'm very happy to be here. Thank you, David. I appreciate that, and it's exciting, and we're doing some exciting things here at Palmetto. They've been having a medical education there since 1991, and I'm happy to continue the tradition.
What is your focus and goals? Is the medical education you do, is it for your great group of doctors and staff, or is it for the community and possible prospective patients who may at one time in their life have to visit your hospital?
Sure. So it's for both, really. And when you talk about medical education, specifically in Palmetto, we're talking about graduate medical education. Or for the lay people out there that may not understand what that means, is that to become a doctor, you go through undergraduate school. That would be a university or college, where you take required courses that you would need for medical school. So you'd be a pre-med student, then you apply for medical schools. Everyone knows that's quite competitive, and you get selected for that. And then you go to 4 years of medical school, where you then get your MD or DO degree. You just had an osteopathic physician on, Dr. Giaimo, and once you graduate from either the allopathic or osteopathic medical school, then you need to make a decision. Back in the day, 50, 60 years ago, you could become a general practitioner and just practice general medicine. Somewhere in the 70s and 80s, it became very popular and now a requirement to become some kind of specialist. Even if you're going to be a general practitioner, you will go into something like family medicine, where you can see anyone in a family on an outpatient basis most of the time. You can be an internist, where you're an internal medicine doctor, and you can see patients both in the outpatient setting or in the hospital. Or you can specialize, and you see patients based on your specialty, whether it be a pediatrician, an obstetrics gynecologist, or a general surgeon. And within those disciplines, there's further what we call subspecialties. Well, that part after medical school is graduate medical education, what you may know in watching the TV shows as the resident, and if you're going to do a subspecialty, the fellow. And so we're in charge of multiple residency programs to train graduates of medical schools or physicians to specialize in their area of expertise.
And so you're right. Go ahead.
That benefits both the medical staff at Palmetto Hospital, who are our default faculty. In other words, those are the teachers, if you will. The faculty would be the same as the teachers that train these young physicians to specialize in their area of expertise of their choosing. And then that in turn benefits the patients, because it's been shown in the medical literature, and it makes a lot of sense, that patients in teaching facilities get higher quality of care and are more satisfied with their care as compared to patients that are in non-teaching facilities.
And you're right. I do watch medical dramas. I'm watching The Good Doctor, so you read my mind on that, about knowing about residency and fellowships, because that takes place with a group of doctors in residency at a hospital. So
absolutely. I even think there's a new show now called The Resident as well. So
that's right.
And it tells the stories of the trials and tribulations of these young doctors in training, because you try to condense a lifetime's worth of experience in a very short amount of time. So that means they have to immerse themselves in their work, like an apprenticeship, if you will. And by the end of 3, 4, 5, 6 years, depending on what specialty you go into, we proclaim you an expert. You take a board exam to certify that you're an expert, and then off you go.
Yeah, and that is an amazing education and training that doctors go through. I've been in PR with doctors in the healthcare landscape for 5 years now. Before that, I was a beat reporter for a newspaper. But I'm amazed at the training and education that physicians go through. I always knew they were the smartest of the bunch, but I've had a few doctors tell me, when you're in residency and you're doing 80-hour weeks, that's what builds the stamina to be able to do, whether you're a heart surgeon, a 10-hour surgery if it's necessary, and a type of aortic abdominal aneurysm repair, or a pulmonologist who has a very high patient number, or even primary care. So kudos to all the doctors for going through all that education and training, and then having people like yourself to help them out. And you obviously know a ton about osteopathic medicine because you work directly with the American Osteopathic Association. So it's safe to say that you're a DO, a medical specialty, or medical title?
So I went to, right. And so, as I mentioned, there's two types of physicians or two types of medical schools in the United States. One is your traditional allopathic medical school, which would be your MD, your medical doctor, and the other one would be your osteopathic medical schools. Osteopathic medical schools have been around, well over 100 years now. They came from the MD schools with an emphasis of having an extra course in musculoskeletal physiology and treatment and so forth. And there's a lot of treatments that we do today to our patients that's commonplace that actually has its principles with osteopathic medicine. A lot of the things that physical therapists now do, occupational therapists do, and even respiratory therapists do in the hospital are treatments that are directly related to some of the osteopathic principles. So everything kind of comes around in a circle with respect to patient care. And then as far as graduate medical education goes, my predecessor, Dr. Mark Morgenstein, who passed away earlier this year, was actually started the program back in 1991 at Palmetto General Hospital as an osteopathic graduate medical program for family medicine. And he should be very proud, and it was under the accreditation of the American Osteopathic Association. And over the course of his 25-plus years at Palmetto General Hospital, he grew it to now have the 6 programs that it now has: family medicine, internal medicine, cardiology, interventional cardiology, infectious disease, and critical care medicine, on top of having a podiatry program. So he really set the bar for all of us and grew the department. What's interesting is that a couple of years ago, the American Osteopathic Association teamed up with the accreditation body of graduate medical education for the medical doctors. It's called the ACGME, the American Council of Graduate Medical Education. And now there's going to be one standard accreditation, and that's going to be the ACGME for everyone come the year 2020. So I was brought in to help transition all of our programs to meet that new standard.
Oh, fantastic. Thanks for explaining that. And that's an amazing legacy that he set in place. And I'm sorry about hearing about his passing, but like I said, it's a great legacy that his friends and family and peers in the medical community like yourself should be very proud about. Now,
absolutely, we're standing on his shoulders. I actually was I did an internship year, a 1-year rotating internship at Palmetto General Hospital way back in, I believe it was 1997, before I did my pediatric and pediatric critical care medicine training at the University of Miami Jackson Memorial Hospital. So my roots are there, so I've come home, so to speak, 20-plus years later.
Well, yeah, thank you for coming back. I've heard a lot about Jackson. I've driven by it many times, and I got to tell you, I've interviewed a lot of doctors over the last 5 years who have trained there, and they're all top notch. So that is an amazing hospital. I heard recently they have over 1,000 beds. Am I right about that? Jackson's that big?
Yeah, it really is that big. It's not just a hospital, but there's a medical complex there. I had the privilege of not only training there, but working there as a professor and doing research there as well. And so it's not just a hospital, but it's a medical complex where they have a medical school and they have research facilities. I worked for instance, at the Miami Project to Cure Paralysis, which was the largest freestanding hospital dedicated to spinal cord injury research, made famous by Mark Bonicani and the surgeon Barth Green. And they've done a lot of important work in that field of neurotrauma, which is my background. And all of that has laid the foundation to carry the principles that I learned about training medical students, residents, and fellows, and even my peers, and taking that knowledge and bringing it to Palmetto General Hospital and implementing that into our curriculum now.
Yeah, I'll never forget about Mark Bonicani. I definitely learned how to tackle properly because of Mr. Bonicani's outreach and awareness. And his dad, as everyone knows, was a great Miami Dolphin. as well, and they're just pillars of the South Florida community. And even though I'm from Jupiter, I feel like I know them personally just because of their awareness. So, and then yourself working on that project, that is fantastic. I didn't know that about you. So thanks for doing that research, and the the medical research going on in this country. I don't think a lot of people know too much about it. I'm saying the general population, but take some time to read a little bit about it, because there's some amazing things going on. And you mentioned that you're a pediatrics and pediatric critical care doctor. That's your specialty?
Yes. So absolutely, I did that. I was a professor at the university for many years, and then moved into the private world and worked. I currently work at, amongst other places, at Palm Beach Children's Hospital in their pediatric intensive care unit. And it's ironic because all my programs, all of our programs at Palmetto General Hospital are adult programs, but the principles of training remain the same. And they obviously center around putting the patient first. And like you said, that stamina, that dedication, that sacrifice, where whatever your personal issues are that day, and everybody has them, whether it be something as simple as being hungry or having to go to the bathroom, or maybe something happening at home, you put those in the back burner, and you go ahead and you treat your patient, and you do what's best for your patient regardless, because of your training. And that occurs during your residency and fellowships. And that's the kind of professionalism and dedication that we try to instill into our young physicians that are going through our programs, so that it becomes second nature. It's not unlike training a soldier to reflexively do what he needs to at a time of crisis. This is the same exact thought process and philosophy.
And so you're on staff also at Palm Beach Children's Hospital in West Palm Beach, and as well as Hialeah?
Yes.
Oh,
yes.
Wow.
So I wear a couple of different hats, but most of my time is spent the past couple of years is with the Palmetto General Hospital. Prior to that, I was my predominant my work predominantly was at Palm Beach Children's Hospital. And then a couple of years ago, I shifted my focus to graduate medical education, and that's what I'm currently doing.
So I'm going to explain this. So Tenet Health, the Florida region, has 10 hospitals in South Florida. There's actually Palmetto General Hospital, where Dr. Brito is the vice president of medical education, is in Miami-Dade. They also have 3 other hospitals in Miami-Dade. And then one in Broward County. You guys all know that. We've had a ton of Florida Medical Center doctors on this program because it's less than a 30-minute drive on a good traffic day from the studio here in Boca. And everyone knows Palm Beach County hospitals here, the 2 trauma centers, one of them St. Mary's Medical Center. So Palm Beach Children's Hospital is on the campus of St. Mary's Medical Center.
That's right.
And, 5 Tenet hospitals in Palm Beach County as well. Well, I read a little bit online, and I didn't have a chance to ask you before the program. Did you also, you're also the director of the concussion clinic at Palm Beach Children's Hospital?
That's absolutely right. On Tuesdays, we have our concussion center. I just came from the concussion center just an hour or so ago, saw my last patient. We've been having that concussion center there at St. Mary's it's a pediatric concussion center for the past 2+ years. It was designed to fill a void where we had our mild traumatic brain injuries or concussions, to follow up those patients and see how they were doing, anywhere from a motor vehicle accident to a football player at a Friday night lights game.
I was going to ask you. We have
everyone across the board.
Yeah, I was going to ask you that question on that topic. We have about 10 more minutes, so the number is 1-888-565-1470. I can get any questions in front of Dr. Brito that are appropriate, or on Facebook Live, All County Healthcare INC. Type that in the search bar. I was going to ask you that same question. We always think of football. I played football. The listeners know I mention it all the time. We always think of that. But what are some of the other ways people, or I should say, children and adolescents are coming to see you for concussions? Do you ever see any from cheerleading, soccer, like you said, auto accidents?
Right. So most of the kids that we see from the concussion center, predominantly, probably half, come from some sports-related concussion. The most common in males, most frequent, the most common is going to be soccer. But the most frequent per sport would be football for boys. Probably number 2 would be basketball, and then number 3 would be soccer as far as incidence of concussion per sport. For girls, as an example, it would be soccer number 1 and basketball number 2. But we see concussions from all sports, equestrian, baseball, you name it, the sport, and we've probably had a concussion from it. So not all sport, playing sports, it's just a part of the game that everyone should be educated on. It shouldn't shy anybody away from playing a sport. It just should be something that the coaches, the trainers, and the parents and the athletes should be aware of and educated on.
Now, if someone is listening to the program or views it at a later date and they think they may have a child or family member with a concussion that fits the pediatric parameters there, how does it work? How do they come see you on Tuesday night? Do they have to call Palm Beach Children's Hospital?
Well, we have a hotline where they could call at any time. It's 1-561 area code 469-4878 or HURT, H-U-R-T. And if anyone has any questions on concussion in general or worried about somebody or just wanted to speak to somebody with regards to concussion, you can call that number and we'll be happy to answer any questions you may have. And that's also how you go ahead and get an appointment. We also give, if we feel over the phone, if there are some concerning signs, we may ask you to go directly to the emergency room and get taken care of if that's indicated. And then we're happy to follow you up in our concussion center where we have a multidisciplinary approach. What that means is you don't just see myself, you also will see a vestibular therapist. Those are experts in balance and so forth, and any other physicians and other resources or services that you may need, where we would be a one-stop shop for that. And we work, again, with the trauma surgeons and see their patients as well. You can get concussions outside of the sports area. Motor vehicle accidents and falls are some of the more common reasons outside of sports-related concussions. And falls can occur anywhere, whether they be in school, outside of school, and motor vehicle accidents are quite common as well. And we're happy to see anyone between the 21 and under. I will even see some patients a little bit over 21 years of age if they're in college and it's sports related.
What a great resource for the community, that the concussion clinic at Palm Beach Children's Hospital on Tuesday evenings. Dr. Brito is the director. Dr. Brito, would you just give out that hotline number again for the concussion clinic? I want to jot it down here.
Sure. It's 1-561-469-4878 or HURT, H-U-R-T. So it's 1-561-469-HURT, H-U-R-T, or 4878.
Wow, thanks. That is a great resource for the community. Now, do you do any work on the sidelines of sporting events for high school or grade school athletics?
I have in the past. I was actually a USA youth football coach. I was involved with my sons that played high school football with their high school football team. I don't do any active participation on the sidelines at this time. other than occasionally go to some local events for education purposes, whether it be to local schools and give them a talk or talk to athletic trainers. But the heavy lifting that's done in our community for that, and they should be recognized, are the athletic trainers who are very well trained every year on multiple injuries, including concussions, and I think they do a fantastic job at being at all the events for the kids, and not only taking care of their brains, but the rest of their body. And there are protocols set forth that are adhered to throughout the state of Florida. I really have been impressed with how the Florida High School Athletic Association has gone out of their way to put concussions on the forefront of everybody's awareness, and also address it and treat it properly, and then guide those kids with concussions to, concussion centers across the state. And kudos also to the general pediatricians who are incredibly supportive, and of course the coaches who are also well informed and aware as well. It's a community. Even the parents are aware now. It's just everyone's involved, and being aware is really the most important thing. And getting that way, you can get the kids in front of the right people to get the right treatment.
That is fantastic. And I know we only have one more minute because I can hear the music coming on. Speed round. Are you a volunteer professor of pediatrics for the University of Vermont College of Medicine?
Yes, I am.
Wow, you're doing it all. You like to stay busy.
Yes.
What are your hobbies and passions in life outside of medicine?
Well, I'm an avid CrossFitter. The CrossFit Open starts on Thursday. I'm ready to go. You can see my name, hopefully, on the leaderboard with the docs across the country.
Nice. Well, you're always welcome on this program. Thanks again, and we'll have you on in the future.
Thanks, Dave. I was happy to be here. Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and